Hi everyone, it's Dr. Gage here, and we are going to start our lesson on exposures, which will also include a talk on why Americans should be interested and concerned about global health. So I know a lot of you guys are living in Beaumont, Texas, or the surrounding areas, and probably for most of your life, you've been living in this area, and very few traveling to other countries abroad, or living in Europe or Asia or parts of Africa or Latin America for extended periods of time. So if you live here in your little community, and we love it here, and we go shopping here, and all of our things that we need are here, it's very easy to get the mentality and the mindset of, why does global health matter to me? I'm living in this town. What does it matter? And that's, now that we have gone through a pandemic, and we are still in a pandemic as of this taping of this video, we are starting to see as collectively why global health matters and why it's so important. So let's start with a few basic definitions. This first slide talks about an epidemic, which is a disease that affects a large number of people within a community, population, or region. The second definition is a pandemic. It's an epidemic that's spread over multiple countries or continents. So if you remember, last March, or even February or so, right before shutdown, basically, the first shutdown in 2020, COVID-19 was an epidemic. It was a disease that affects a large number of people within a community. So we weren't seeing these large this large spread of COVID-19, not just yet, but then relatively quickly, the WHO, the World Health Organization, escalated COVID-19 from an epidemic to a pandemic. So that then meant that the epidemic has now spread over multiple countries or continents. So that's what happened. Now, what we are hoping after vaccine rollout, if all goes well, is that COVID-19 will move from a pandemic to being endemic. So don't confuse epidemic with endemic. There is a difference. So that's something that belongs to particular people or countries, something that it's just something that we just always have. So for example, the flu is endemic. Every year is flu season. We know it's an issue. It's not affecting, the same amount of people in the same level, as what would be happening during a pandemic or an endemic, or epidemic. So that's endemic. So we're hoping that COVID-19 becomes endemic. That's probably what will happen after after everybody gets vaccinated or has had COVID, or whatever happens after this. And an outbreak, we've seen movies, named Outbreak. So it's just as what you see, it's a greater than anticipated increase in the number of endemic cases. It can also be a single case in a new area. If it's not quickly controlled, an outbreak can become an epidemic. So first, there was an outbreak in China with COVID-19. The outbreak quickly became an epidemic, then quickly was escalated to a pandemic. And so now, after vaccine rollout, we probably are not going to eradicate COVID 100%. So it will then become endemic. Moving on to the next slide. Bear with me a moment. Yay. Okay. Moving on to the next slide. This is an example of what COVID-19 looked like back during March 2020. You see lots and lots and lots of red dots in Europe. But what you can see from this picture is that at this point, COVID-19 is in pretty much every country and every continent. So is this a pandemic or is this an epidemic at this point? If you have answered pandemic, you are right. Very good. So what started as an outbreak, which was an epidemic, which became a pandemic because it spread everywhere, is what you're seeing on this map. Okay. So SARS, which is also a type of coronavirus, which is what is also in the same family as COVID-19, they're all coronaviruses, was an epidemic. Okay. And this is a map showing the SARS epidemic back in the early 2000s. And as you can see, there are not as many cases and not covering as many countries as what we are looking at when we look at the sheer size and numbers and span of red dots from this map to this map. So disease can travel very easily now these days by airplane, person to person. And so when you have something that is so contagious as COVID, it easily traveled from person to person. A plane ride accelerated the spread of COVID just like wildfire. And that's what you see in the video of this week called I Can't Breathe Is It COVID-19? It shows me traveling from Europe back to America and how easily and quickly COVID-19 can spread, which is why global health is so important, because now with travel being easier and accessible to virtually everyone who has a passport or even a birth certificate, if you're just going down to Mexico and has enough funds, who can hop on a plane, and now we can get in an Airbnb and do just this low cost traveling. People are flying and back and forth, and the world is now so interconnected that if you have one disease that's impacting one country, it can easily spread back home to your home country and get you right here in little old Beaumont, Texas, something that normally shouldn't even be impacting you, that's happening all the way across the globe. So that's why it's important that America does its part in keeping the world healthy, because diseases and illnesses are not isolated to one country anymore. That just isn't how the world works anymore. And we have seen this now absolutely with COVID-19. So here on this next slide are some more basic definitions of epidemic versus pandemic. And the suggestion here is to think of P in pandemic, which means has a passport. So a pandemic is an epidemic that travels. So it's spreading like wildfire. And then an epidemic versus endemic, it's when it's used to describe a problem that's out of control. So for example, the opioid epidemic, it's an out of control problem in the US. And an epidemic is often localized to a region or a place, but the number of people impacted is higher than what you would expect or what's normal. So that's what we saw happen with COVID. Endemics are, happen often in a specific location. So as I said, for us, flu is something that's endemic. This gives an example of malaria. In Africa, it's something that's, pretty, common with getting it there. If you, are in some parts of Africa, some of the countries there. So an endemic versus an outbreak. So an endemic can lead to an outbreak. So an outbreak can happen anywhere. So what we saw with COVID-19, the outbreak happened, but that's not an example from an endemic leading to an outbreak, because yes, COVID because first it was an outbreak and we're hoping that it becomes endemic. But let's say that we get COVID-19 under control and it becomes endemic, but we don't get it as under control as what we are hoping that we get it. And then it starts firing back up and then you get an outbreak. And so the best thing to do is to go in and nip that outbreak in the bud before it blows up and becomes an epidemic, and before that blows up and becomes a pandemic. Moving on to the next slide, I think a number of you probably remember Zika viruses. And I had a friend, for example, who was pregnant during Zika, and a lot of the children were born with deformities whose mothers were bit by the mosquitoes that caused Zika. And so we were afraid because it started in South America and moved across the border to the US. A lot of people in Florida, for example, and Texas were really afraid, who were pregnant, that they didn't want to get Zika. So this is showing you how global health is important. So for us, it's really important, in the States, that they are controlling mosquitoes and standing water, et cetera, in South America, because if you get the Zika, it can cross over into our country, and we don't want that to happen, which is why global health matters to Americans. Moving on to the next slide, polio used to be a big problem in America, and now it's only considered endemic. There's that word again, endemic, in Afghanistan, Pakistan, and Nigeria. So right now it's gone down from 125 countries back in 1988, where you see like all of these countries here that are, suffering from polio, down to just these 3 tiny countries. Well, now that people from these countries can easily travel to our country, or that we go down to these countries, etc., and you are starting to have less and less and less people who are vaccinating in our countries, it's possible that, we're going to get a new problem with polio if that keeps happening, like what we are seeing with measles, for example. A lot of people are not vaccinating for measles, their children, and this slide shows that a lot of children are at risk of missing their measles vaccines because of COVID. So hopefully what we don't get next is, measles becoming even more, it's starting to become a small problem here, but let's say it blows up. Sometimes you hear about it in the news, but let's say it then blows up and becomes an even bigger issue that we're going to see an after effect, some of these latent after effects that we don't know about right now that are going to be a problem because of COVID-19. So we know a lot of children are missing out on their measles vaccines because of COVID. So how big of a problem is that going to be, say, down the line in a year or two, if we get a measles outbreak, for example? Because it's important. The reason why we're able to get away with some parents who choose not to vaccinate their children in the higher income countries, like what's happening in Western Europe and America, is because of herd immunity. So herd immunity, and you've probably heard it in the news because of COVID-19, a lot of people were hoping for herd immunity would happen with COVID-19. So in Sweden, for example, let them run rampant and let COVID-19 run unchecked throughout their country, hoping that they would get herd immunity. You heard also of American government pushing for herd immunity. But one of the problems with COVID-19 is that they weren't reaching it, and the fatality rate in elderly people, it's quite a risky thing to do. So the top portion shows when no one has immunity, the contagion has many opportunities to spread quickly. So that's what happened to COVID-19. No one had immunity, and it spread like wildfire. With measles, we're starting to see less people have immunity. So sometimes we're seeing, measles outbreaks coming into the news. Like we saw that with France, like somebody traveled to France and there happened to be somebody with measles on that plane. And we had measles cases in America again and had an outbreak. The second part down here shows that the more immunity we have in the system, the less often contagion comes into contact with the susceptible. So what I am hoping is that because I already had COVID-19, that that I have some type of immunity that will last. But we don't know now how long it will last. Some people say 5 months. Some people say now people like me who got sick early on back in March, their immunity is gone. Some people say look at T cells. But the reality is we just don't know yet. And it's not possible because not enough time has elapsed. But we're hoping that the more people who are getting either the vaccine or have been impacted by COVID-19, then the less people COVID-19 has the possibility to infect somebody else. And then you get that third point. That's what we're really hoping for, is that the spread of the contagious disease is contained. So I gave you a reading this week, two of them to think about exposure, the exposure variable. So in epidemiology, the exposure is a factor that may or may not influence your outcome. So if you are, an exposure can be many, many things. It can be environmental. So if you are exposed to bad air, the possibility that you have asthma increases. If you are exposed to an unsafe environment where you can't exercise, then the possibility that the outcome of obesity may increase. I give you a reading today about the prison populations, and it shows that people who have been exposed to incarceration have a higher risk of stress-related illnesses. And what we saw with, for example, COVID-19 in prisons, they didn't have access to a lot of to sanitary products, to masks, and subsequently, COVID-19 ran rampant in prison facilities. What does that mean for herd immunity? We don't know. That's one way that we will be able to use prisons as a natural experiment, which we will learn about later in this course, what a natural experiment is. But basically, we'll be able to use these, prisons as a way to see is COVID-19, is the contaminant spreading as fast as it was spreading last year as compared to this year? Because we know that the prisoners aren't getting vaccinated. They're like the last on the list. We have a number of people ahead of them. So then what will those prison populations look like in 2021 or 2022? Will they have built up herd immunity? So only time will tell. So important vocab words we learned about last week, but we talked about this week: outbreak, pandemic, epidemic, endemic, exposure, and odds ratio. There's a video on that this week. So just keep this in mind as well. I want to leave you with this. When you see the words global pandemic, remember this, okay? I want you to remember this. You don't have to say global pandemic. That's something that you can take away from this course. That's one of the things I want you to take away. Why would you not need to say global pandemic? You've seen people saying this in the media. They're not trained epidemiologists, but you guys now are exposed to why you don't need to say global pandemic. Why? Because pandemic inherently means the definition of pandemic is that it's with the P for passport. It's happening across multiple countries, multiple continents. It's global. So we don't need to say global pandemic because we know the definition of pandemic. So we just can say pandemic, okay? So we are hoping that the outbreak in Wuhan, China, that started as an epidemic that then became a pandemic will soon become endemic. Okay, so that's a very epi type of sentence that I want you guys to take home with you this week and try it on your loved one. Show your fancy words, what you're learning from your epi class, and apply it into your real life. And so at the end of this slides, I have 3 educational videos that I would like you to watch. The first one is from pbs.org, and it shows how COVID-19 spread around the world. It's an animation done by John Hopkins. The second one is a talk by a doctor from Houston Methodist about the vaccine and how the vaccine is made, and that it's an mRNA, and it's based off a copy of your DNA, so it's not live virus. So he's talking about how the vaccine works. And the third video is about Kizzy PhD, and that is a woman who is an African American scientist who worked with the Moderna vaccine, which right now is because of the allergy with the vaccine, that there are a lot of people having allergic reactions, and so they're stopping to look into that. But I want you to be abreast of what's going on, because that's what epidemiologists are. So an epidemiologist is looking at these things and reading these things. So that's why I want you to be exposed to this content. So please take a moment, look at it on your phone or whatever while you're cooking dinner, or doing whatever it is you do. Just let it run so that you can hear it and be exposed to it, because these terms you will see again, but it's just also good to know because you're hearing about it in the media. So why not really know what it's about?